there's one emotion that I feel every single day, and that is the one of feeling inspired by what we see literally in the view of our screens on TV or in social media, or by what the governor and I see in our work every day. And that's the amazing ability for our first responders and emergency responders to leave their families, to put on gear that they wouldn't normally put on, and to get out there and serve and protect the people of their community and of this Commonwealth. In particular, to see the frontline medical community do amazing work without question, going into rooms with sick patients, literally coming into contact with a part of humanity that is diagnosed with this illness and helping them recover is just really, to all of us, really amazing to see, but I think we all feel very grateful that we have these brave men and women among us doing that work for us every single day. And unfortunately, they'll be at it for a lot longer and certainly deserve our prayers and support. I want to just express how grateful I am to UMass Medical, and in particular, Dr. Eric Dixon. I had a conversation with him at the beginning of this effort, and he said, LG, don't worry, I got this. This is what I'm made for. I know how to do this. You know, I'm an emergency medicine professional, and I've been here, and I'm ready to take this on. And I was able to listen in to the UMass command meeting that they have every morning. And although I physically wasn't there, I felt an incredible sense of collaboration, professionalism, support to each member of that team to make decisions in the best interest and health of the people that UMass would need to serve. And for them to literally, raise their hand and say, we can set up this bed capacity, which we know we will need because we do not have enough capacity in our ICUs to handle the patients that need the care there and the ones that are stepping out of that care into a less acute need without setting up a field hospital like this. And to see them literally greet the trucks coming in and to unpack this equipment, and it literally medical students graduating online yesterday that will be coming into this facility to care for the individuals in our community is really outstanding, and I couldn't be more proud of the UMass team. I would like to give sort of a call to action on behalf of Dr. Dixon. While this is a physical setup, it doesn't work without the professional people here to staff it. And at full capacity, with 250 beds full, they will need docs and residents and registered nurses and personal care associates to help take care of this population of people. So he's recruiting volunteers to step up and devote their time to help with this effort. You can go online to their website, fill out the application, and be part of the team to help fight back the COVID-19 epidemic here in our Commonwealth. The other group that I'd like to acknowledge is the City of Worcester, because UMass has partnered with the City of Worcester to stand up this facility, to operate it and staff it. And I can't help but think that the City of Worcester is ready for this moment, but they're made for this moment. And it's perhaps because the city has had experience managing through crises in the past. I think many of you think of Worcester and you think of our fire service and how impacted it has been over these past decades. And so they are clearly able to rise to this occasion and to work in partnership with the federal government, with UMass, to set up this facility and to serve. So today, I hope that in the midst of the chaos and the sadness and the disruption that COVID-19 brings to all of us, that you too feel inspired by the amazing men and women who literally are gowning up and gearing up with more protective equipment on the way to help them do their jobs to make people healthier and safer, not only through this crisis, but to be prepared after it, to be ready to get back into the routines and lifestyles that we so appreciate.